What would you say, Bill, are some of the most common mistakes that people make with enrollment timing? And what kind of penalties can occur if they get it wrong?
The most common mistake they make is probably not enrolling in Medicare soon enough. Sometimes I'll get a phone call from somebody who said, yeah, I enrolled about a week ago and I wanted to start like at the end of the month. I said, well, you need a little bit more time than that. Normally you should have about 60 days previous to your Medicare Part A and B starting to get the process started. That way you'll know you have your card in hand, because you need to get your card with a number before you can get additional coverage. So that's really important. If someone does not enroll in Medicare and they don't have other coverage, they can receive a penalty past 3 months past their initial enrollment period, which would be their birth month. So those penalties can add up. One of the biggest mistakes people make, though, is that sometimes people leave the country and they turn 65 under out of the country. Because they're in a different country, they may have health insurance through a national health plan, right? So then they return to the United States and they're maybe 3 or 4 years past their 65th birthday. Well, because they did not enroll in Medicare while they were out of the country, they will receive a penalty. That's happened to a couple of my clients, and it can be quite hefty. It's 10% a year for every year you do not have Medicare insurance. So,
wow, yeah,
that's one of the bigger mistakes, I would say. And I've actually advised a couple of my clients that are living abroad and may move back to say, listen, you need to enroll in Medicare. I know there's a premium involved. You have to pay the premium, but it will pay off in the long run when you return home. So.